Hi, Jonathan Marks here with Andrea Spencer, MD. She's an assistant in psychiatry at Massachusetts General Hospital and an instructor at Harvard Medical School. She spends half her time conducting clinical research in psychiatry within primary care and also in ADHD and PTSD. She's going to be speaking at APSARD, the 7th annual meeting of the American Professional Society of ADHD and Related Disorders. They're having their meeting in Washington, D.C. on January 15th to 17th, 2016, and Dr. Spencer's topic is entitled ADHD and Comorbidities in Primary Care, Diagnosis and Treatments. Doctor, can you tell us a little bit about what you'll be presenting?
Sure thing. I will be talking about the identification of ADHD and other related or comorbid psychiatric disorders in the primary care setting, and not just detecting and diagnosing those disorders, but also how we go about treating them within the primary care setting. So I should say that besides my clinical research responsibilities, I work as an embedded psychiatrist in a pediatric primary care setting. And so my dual role as a researcher as well as a clinician is very important because it allows me to think about the real-world application of what I study in the primary care setting. When I present at APSARD, I will be talking about both the model in which I practice as well as models that can be used in other places and pros and cons of how those things work and what we know through the research that we've done on our program at MGH Chelsea specifically.
If you don't mind my asking, Andrea, ADHD in children has been known for like 100 years. What's new these days that we're still learning about?
Jonathan, as you put it, ADHD is an illness that has been treated for a long time. We've recognized it, we know how to diagnose it, and we have some good treatments for it. The American Academy of Child and Adolescent Psychiatry and the American Academy of Pediatrics have put out clear guidelines on how to treat ADHD, but paradoxically it hasn't always translated into good care or really good outcomes for kids with ADHD in the community. So part of our new task has been to try to figure out how we can improve that care of kids with ADHD in the community and how we can also recognize the presence of other conditions too that might seem like ADHD or might be existing in addition to ADHD, and how do we improve care for those conditions too when they're present together with ADHD.
So Andrea, can you give us an example of where pediatric care is lacking in ADHD?
Sure. I think I'll give you a couple of examples. One example is related to early detection and screening for ADHD. Most of the time, ADHD is recognized once a child has significant academic impairments or behavioral issues as a result of their symptoms. And so right now, Massachusetts, where I'm from, kind of leads the charge in terms of recognizing that screening for behavioral health issues and psychiatric disorders is important to well child care and improving outcomes. But although ADHD is a very common illness, specifically screening for ADHD is not something that is typically practiced. And so improving on screening procedures is definitely one area that can be improved. I would say another area that can be improved is really, besides screening for and systematically evaluating ADHD symptoms, systematically evaluating for comorbidities in a more comprehensive way for kids who have ADHD symptoms is critical. And we have found in our sample that actually most kids who are diagnosed with ADHD in pediatric primary care have other symptoms as well. And that's a very important thing to recognize.
Good. So she's going to be helping practitioners and other specialists in ADHD improve care for children and also families. And so we're very excited to hear this presentation again at the 7th annual meeting of APSARD, the American Professional Society of ADHD-Related Disorders, meeting this January 15th to 17th in Washington, D.C. Thanks so much for being with us, Andrea.
Thank you so much, Jonathan.